Welcome. My name is Jeanette Magnus, and I am the Director for the Center for Global Health at the University of Oslo here in Norway. The Center for Global Health is in collaboration with Norwegian Institute of Public Health, the Norwegian University of Life Sciences, and the three other universities and Oslo centers, UiO Nordic, UiO Energy, and the Center for Development and Environment, hosting the Norwegian launch of the 2021 report of the Lancet Countdown on health and climate change, just one day after the main global launch in London. The Lancet Countdown is an international collaboration that independently monitors the health consequences of a changing climate, publishing updated, new, and improved indicators each year. The Lancet Countdown represents the consensus of leading researchers from 43 academic institutions and UN agencies. The 44 indicators of this report expose an unabated rise in the health impact of climate change and the current health consequences of the delay and inconsistent response of countries around the globe, providing a clear imperative for accelerated action that puts the health of people and planet above all else. The action called for warranted radical collaboration, and we hereby seek to mobilize the Norwegian academic milieu to action for planetary health, to protect human health. We have an exciting program ahead of us with Norwegian academicians and a wide-ranging expertise and experience. We will now give the word to today's moderator, Dr. Karine Nordstrand, Department Director of Global Health at the Norwegian Institute of Public Health, and also the President of MSF, Leger Uten Grenser in Norway. Over to you, Karine.
Thank you, Jeanette. And indeed, we have an exciting program ahead of us where you will be presented with not only the global perspective, but also their relevance in a Norwegian context. This year, as the first Nordic contribution, a policy brief for Norway has been published alongside the 2021 Lancet Countdown report. And in the policy brief, we have chosen to focus on three indicators that we find most relevant to the Norwegian context. And Kristian Rødland, one of the lead authors, will provide us with the highlights. We have also invited three experts in the relevant fields to share their experiences and perspectives on the recommendations provided. Before we get started, I would like to mention a few house rules for this event, so please pay attention. When you registered, you agreed to the session being recorded so that we can make the link available also to those not able to join live. All the participants' microphones and videos will remain inactive throughout the event, and this webinar will consist of a short presentation by each speaker, followed by a panel discussion and an open Q&A session at the end. So we really encourage the audience to engage with our speakers during the Q&A by posting questions, and this can be done by using the Q&A button located at the bottom of your Zoom screen. This can be done either by using your full name or anonymously. So let's get started. To set the scene, we will first take a bird's eye perspective, first globally and then nationally. We have the honor of having Professor Jan C. Semenza with us, joining from the Heidelberg Institute of Global Health. Dr. Semenza has a long-standing career within global health, including a focus on environmental and climatic drivers of disease. He's also the co-lead of two working groups of the Lancet Countdown in Europe, and will present us with some of the main findings and trends emerging from the 2021 Countdown report. I hereby give the word to you, Dr. Semenza. Please go ahead.
Thank you, Karine. Thanks for inviting us to speak here. Let me see if I can pull this up. Can you see this?
Yes.
Great, thanks. So thanks again for giving us the opportunity to present a bird's eye view of the Lancet Countdown Report 2021. I'll show this first slide here with the headline Code Red for Healthy Future, which basically summarizes the findings of this report that indicates that we need to activate our sirens and flashlights because we are in the red zone, so to speak, when it comes to these health indicators for climate change, from climate change. In fact, when we look at these indicators throughout the report, all of them are very much concerning. So we look at heat wave indicators or vulnerability indicators to the heat, climate sensitivity to infectious diseases or droughts or food insecurity. And all of those indicators are of concerns throughout the world. So I'll show you some of the data in the next few slides, but that's the first take-home message. Another take-home message comes from the COVID-19 response that indicates that our health systems need to be improved, that we need to make sure that climate change strategies incorporated into our health systems. We need to make sure that our urban landscapes are adapted to the rising heat and that we are prepared for health emergencies. And then again about COVID-19, that we make sure that the health determinants of climate change are addressed during big meetings from like at the United Nations, not just COVID-19 related issues, but also climate change related health issues. And that we make sure that the recovery plans reduce the greenhouse gas emissions in the future. So that's just the three issues of the most recent report. But we have been writing these reports for many years now. In fact, it started in 2015. And the aim was to have two types of indicators, broadly speaking, indicators that track the threats to health from climate change, but also the response to climate change as potential opportunities for society to adjust and improve. And if you look at this slide here, it's kind of a complicated, interconnected slide, but we basically have 5 working groups at the Lancet Countdown. The first one looks at impacts, which is indicated at the bottom here in purple. Then we have the adaptation working group. We have mitigation, economic and political aspects. And so we are trying to track trends along those 5 categories: the impact, adaptation, mitigation, economic and political across the board, globally, ideally, to see where we stand with our with the situation worldwide. And the most recent report here has 44 indicators, as Jeanette mentioned earlier, across these 5 domains that I just mentioned. And there are a few things that are new. For example, we decided to track heat and physical activity, basically loss of safe hours to exercise. This is a new indicator in the 21 report. We also looked at heat and sentiment, as you can see here on this slide, that we track using online Twitter data. And then we try to differentiate now in this new report between production-based and consumption-based CO2 emissions, and what does that mean with the pollutants, the PM particulate matters. So as opposed to just looking at the emissions, we just want to know how much emissions are here for consumption and how much is it just production that might actually be exported. So then you get a more equitable assessment of what's going on in the world. And so let me just dive into some of these indicators just to whet your appetite to look at the report. I can't cover obviously the entire report, but this one here looks at exposure to vulnerable populations to heat waves. And you can see here on this bar graph, and if you can see my cursor, over the last 10 years, there has been an increase in that vulnerability to heat waves among populations 65 and older. We also see an increase among the young to these type of heat waves. So that's a concerning trend right there. Another endpoint that we are looking at is heat-related mortality throughout the years. And here we compute the deviation from a baseline that's acceptable for human well-being, and then we compute that heat-related mortality risk throughout the world based on populations at risk, again, the 65 years and older. So this is another indicator that we have been monitoring over the years. Another indicator are the wildfires, where we compare a baseline to more recent data, and we can see an increase in that wildfire risk throughout the world. Again, this is an estimated computed risk taking into account meteorologic data like droughts and heat and things like that. And then, of course, population densities and so on to assess that wildfire risk to human health. Another indicator category is the infectious disease outcome. And so we look at the number of infectious diseases here. The most relevant for Norway is the Vibrio indicator, which is basically a marine bacteria that lives in the Baltic Sea due to the low salinity in the Baltic. And in fact, these bacteria are also found in the North Sea or in the Mediterranean at the estuary where the fresh water dilutes the salt water. And these bacteria are potentially life-threatening because they can cause septicemia or gastroenteritis or wound infections that are potentially life-threatening. And we see this increasing trend on the right bottom corner of this slide here in the Baltic and also in the Chesapeake Bay in the United States, which is a big concern for public health in those settings. And this one here is another indicator that's relevant for Norway. Here we look at marine food security and undernutrition, because it turns out that worldwide the sea surface temperature has been increasing consistently throughout the years. And here we compare a baseline from 2003 and 5 to 2018 and 20, and we see that nearly 70% of countries show an increase. And none of this is visible on your screen, but here this is the zero baseline. And this is the minus, which means this is a cooling, and this one here is a warming. And Norway is right around here, where we have observed a warming in the sea surface temperature compared to the baseline over the years of several percent, which is of concern to the fisheries, because we have seen a steady decrease in marine capture-based fish. You can see the blue line here on this bar, on this line on the right, coupled with an increase in farm-based consumption. So we believe that the warming of the ocean has in fact something to do with the marine capture yield. And that is obviously of concern. If you look at Norway in particular, the blue line here represents the marine capture-based fish yield compared to the farmed-based. And you all know that Norway is one of the leading producers of farm-based salmon in the world. So those were the indicators that have a health endpoint. Then we also have adaptation indicators, and we look at the number of those on this slide here. For example, how many countries have implemented a national adaptation plan. And here's another one. We're looking at air conditioning, because obviously air conditioning is essential to protect for heat-related mortality during heat waves. And so there is a benefit to that. You can see here the estimated improvement in heat-related deaths that were prevented due to air conditioning use. But obviously there are also drawbacks from air conditioning, such as air pollutants that are being put out and urban heat island impact, because they are used in urban settings and they produce heat as well. And then of course we have the greenhouse gas emissions from the electricity that they consume. So there are benefits and harms from air conditioning that need to be taken into account, and we can discuss the potential strategies, how to come up with better solutions about that. We have also used remote sensing to assess urban green spaces, where we use the NDVI, or the vegetation index in urban cities, to assess the green cover in countries to see how that potentially protects human populations from heat waves. And then we have mitigation indicators. And again, this is a big category also of different types of indicators, but just to give you a taste of what we're looking at, here we see that electricity use for transport has increased by 17% compared to our baseline. And we have now 7.2 million cars that are electrically powered worldwide, which is probably a good thing as long as the electricity is produced in a sustainable way. Then an economics indicator here is looking at the de-investment of funds from the fossil fuel industry, and you can see the healthcare institutions that have pulled out of fossil fuels, and then the global investment in fossil fuels where that de-investment has improved also over the years, but obviously there is a long way to go. Then we also looked at public and political engagement, and then there are a number of indicators here also. And just to mention one of them, we have seen an increase in media coverage of climate change and health over the years. There was a peak before the COVID-19 pandemic, but obviously that took over and outshined the climate change work that we have done in the meantime. But hopefully that this will get more attention in the future, because it's obviously a problem that's here to stay. So just in summary, we believe that these health impacts of climate change are a concern. If you look at these indicators across the board, and that's what we call this particular report Code Red for Health. We were concerned about the healthcare capacity issues that we had during the COVID pandemic, and we are concerned that the convergence of these compounding risks, COVID and climate change, will be an issue for the healthcare system that we need to take into account. And on the other hand, this is also an unprecedented opportunity for a better future. If we can convince the world leaders to take action to address this predicament to public health and the world at large. And I stop here. Over to you. Thanks a lot, Karine.
Thanks a lot, Jan, for sharing these really critical insights and demonstrating so clearly the complexity of the intersection between climate change and health. And certainly a lot of food for thought there, and looking forward to having you with us with the panel discussion at the end of this session. So next speaker out is Bjørn Samset. Mr. Samset is a senior climate scientist working at the Interdisciplinary Research Institute CICERO in Oslo. His background is in physics, but he has worked on climate change issues for over a decade now. Recently, he has also been coordinating lead author on the 6th assessment report of the Intergovernmental Panel on Climate Change. So I hereby give the word to Bjørn to tell us more about the state of affairs from a Norwegian perspective. Please go ahead, Bjørn.
Thank you. Thank you all for inviting me here, and thanks for producing this extremely important report. What I've been asked to do is to give a state of affairs of what is happening to the global climate currently and over the near future. That I will do with a basis in this report, which came out very recently, that I was also one of 230 authors of, which is the first part of the 6th assessment report from the Intergovernmental Panel on Climate Change. Now, this report is basically a status report for everything we know about the physical part of climate and climate change. So, what is changing in the climate? Why is it changing? And how will it evolve into the future? And then there are 2 other parts of the report which delve more into the aspects that are maybe more relevant to this audience. So, the interactions between the physical change and health and other types of societal risk. I'll come back to that towards the end, but just to say from the outset that that report is still to come. So this is kind of the first step. It's the problem description, if you will, for climate change. What is happening to the climate? Well, there is just one answer to that. Basically, everything is happening. There are changes wherever we look, from high up in the atmosphere to far down in the oceans and everywhere in between. The conclusion from the report is that recent changes in the climate, they are widespread, they are rapid, they are intensifying, and they are unprecedented in thousands of years. Put another way, we have never seen climate like this in the history of humanity, and we have never seen a climate changing in this way in the history of our civilization, or at least in the history of modern society. We see this better by looking at kind of the canonical graph, if you will, of climate change, which is the change in surface temperature. That's where we have the term global warming. The surface of the Earth has warmed by 1.1 degrees since the period between 1850 and 1900. That's what you see on the right there. On the left, you see the same story, just with a longer tail, going all the way back to year one. So all of our modern time reckoning. You can see that for all that period, I mean, that's when we developed from, well, we certainly had a society in year one, but it was nowhere near the complex multi-billion or 8 billion people society that we have today, with all its pros and cons and issues. And over that era, we've had a stable global temperature until the period of 1850 to 1900. That was kind of the last part of the stable temperature. And then this temperature really skyrocketed. So it has warmed, the surface has warmed in a rate that is unprecedented in at least the last 2,000 years. Well, that is just one aspect that is changing. We see changes everywhere. The CO2 concentration, for instance, which is, of course, a key part of the greenhouse effect. That's the main cause for this change. It is now the highest in 2 million years. Sea level rise. I mean, our society is mostly built close to the coastlines around the world, where we now strongly notice sea level rise, which is now at its fastest rate in at least 3,000 years. Arctic sea ice, which is important to us, it's in our neighborhood, it is now at its lowest level for at least 1,000 years. Glaciers, which are important worldwide for a number of reasons, chief among them maybe being that they provide fresh water for a large number of people. They are retreating rapidly, and they're retreating at a rate that is unprecedented in 2,000 years. These are broad or kind of slightly abstract changes, but they also influence things that affect us a lot more directly, like extreme heat, which was also mentioned by the previous speaker, which becomes more frequent and more intense. The intense rainfall, extreme rain, which also becomes more frequent and more intense. We have observed this. Droughts are increasing in some regions. Fire weather, so the preconditions for large forest fires are becoming, these conditions are becoming more frequent. They're also shifting into new regions. So we're seeing more fires with damaging health damaging smoke as one of many consequences. They are shifting into the boreal areas and further towards the Arctic Circle, for instance. We are seeing major changes also in the oceans. They're warming, they're acidifying, they're losing oxygen, etc. So briefly, we are seeing changes in all parts of the climate system. Now, I'm not going to spend a long time now telling you why this is happening, because that is now very well established. It is indisputable that human activities are the main cause of this. I would like to repeat that they're not just the main cause. This is our climate change attribution chart from the report, and just by comparing these two, the one on the left, the gray bar, is what the warming that we have observed. The first of the red bars on the right, that is the warming that we can attribute to human influence. And as you can visually see, they are for all practical purposes identical. So conclusion from this report and from previous reports is just to repeat that not only are we affecting the climate, all the changes that we are now talking about are directly due to our emissions, our various types of emissions, which go beyond CO2. There's methane, there are aerosols, there's a large set of emissions, but CO2 is still the dominant driver. Looking a little bit behind, because I mean, these are the global numbers. We all know that the world is not a global mean. Climate change presents itself very differently in different parts of the world. Our vulnerabilities to climate change are very different in different parts of the world. So we also need the regional picture. This is a stylized type map where we've turn regions of the world into hexagons, just so we can see the evolution of different types of extreme weather in different parts of the world. I don't expect you to read the details here. What I want you to do is to see the pattern of 3 of them. So this is for extreme heat. And you can see from the red color that we are seeing, or observing an increase in extreme heat in all parts of the world with very few exceptions. All these dots on there, that just means that we have directly, with scientific certainty, attributed these changes to global warming and hence to human emissions. But then we have extreme rainfall and we have drought. And I'm consciously flashing these a little bit fast because I want you just to see that the pattern is different between these. So the way climate change shows itself in different areas and hence the impact that it will have is very dependent on where you live. And of course, the impacts, the exposure to vulnerabilities that we have that all make up climate risk, they're also very dependent on where you live. So that's another message here, that even though climate change will continue, we have to go beyond these global means and really see what changes in each area of the world. Now, next message, no surprise, but still, unless there are immediate, rapid, and large-scale reductions, we will not be able to stay within the desired limit of 1.5 degrees warming that was set out in the Paris Agreement. Maybe not even the 2 degrees, which is the absolute top line. This is a graph showing future global evolution of temperature. So on the left, you can see the same observations that I showed you before, this 1.1 degree of warming. And then what happens in the future, of course, depends on today's and on tomorrow's emissions. So we have to make some guesses. We can guess that either the emissions will go down very, very rapidly and go to 0 already around 2050. That's the lightest blue line at the bottom. That's how temperature will then evolve. Or we can assume that there will be no cuts in emissions whatsoever. We just continue to industrialize the rest of the world, and emissions from fossil fuels will just keep rising. That's another extreme possibility. That's the darkest red on top. And of course, what actually happens will be somewhere in between those lines. That's why we have this full spread. But the important thing here is to see that in the near term, which is the next 20 years, so from 2020 up to 2040, you see that all these lines are relatively close to each other. And they all go above the 1.5 line somewhere in this 20-year period, which means that we will get at least 0.5 degree of global warming more than we have today, no matter what we do. Beyond that, it really starts to matter what we do. We have a large space of opportunity to reduce and to reduce emissions and avoid the worst impacts of climate change. But for a while, the momentum of our emissions system and our energy system and the climate itself is such that we have to accept that climate change and its impacts and climate risks will increase for a while yet. So how will that look in different parts of the world? Well, I said hazards will intensify in all regions of the world. That's when it starts to get complex or interesting. This is how it looks. If you want the full picture, which I don't expect you to take in, this is just to show you that there are many things that we know will change. Red here means something that will increase, blue means something that will decrease. And on this chart, you have heat, you have mean precipitation, you have flooding, you have fire weather, you have coastal flooding, etc., etc. If I just blow up one part here, which is sub-Saharan Africa, because that in the different regions we see here, we can say with certainty that in many regions, heavy precipitation will continue to increase, extreme heat will continue to increase, glaciers will continue to melt in the extent that they exist there, fire weather will continue to increase, etc., etc. All these are underlying drivers that we have to take into account when we look at the full climate spectrum of climate risk, and of course the influence of climate change on health. The full picture of climate risk will be assessed by the IPCC in the second part of this sixth assessment report, which will come out, if everything goes well, on February 21st in 2022. There you will have these considerations of climate risk, which take into account both actual physical changes, so weather and climate events, how vulnerable we are to these changes and how exposed we are to these changes. I'm going to flash you one graph just to prepare you, because for those of you who haven't seen these, you will see a lot of these graphs when this Working Group 2 report comes out. There are so-called burning ember graphs, which quantify the change in climate risk as the world heats. So these have global warming on the y-axis or upwards, so that 1 degree change on the bottom, then 2 degrees, then 3 degrees, 4 degrees upwards. And you can see from the colors how climate risk intensifies. This example is from a report from 2019, is on food supply instabilities, which personally I think is extremely scary. It shows that even just above 2 degrees, we are entering the highest level of risk for sustained food supply disruptions globally. There will be similar charts to this, more closely related to health in this Working Group 2 reports. I strongly encourage you to look at that when it comes out. And yes, from that, I will just go back to my first slide, which is really to emphasize that major changes are happening across the climate system. They are unprecedented in thousands of years. They will continue for a while, and we simply have to adapt and try to cut emissions as rapidly as we can. Thank you.
Thank you, Bjørn. Not an easy task to summarize the state of affairs in 10 minutes, but you managed very well, I think. And in medical terms, the diagnosis and not least the prognosis you presented was quite clear, I think. Now we're going to take a deeper dive into 3 particular aspects related to the health consequences of climate change that can be particularly relevant in a Norwegian context. So I will now give the word to Dr. Kristian Rødland, who is a senior medical officer and colleague at the Norwegian Institute of Public Health, and who has really been, I have to say, a main driving force in the work behind the Norwegian policy brief. Kristian has a background in research on antimicrobial resistance and One Health, and is also an associate professor at the Center for Global Health. So please go ahead, Kristian.
Thank you very much, Karine, for those kind words. I just have one slide I just want to put in the background. Just give me a small second. Yes, I hope that is okay, that you can see this. I'm just going to spend a couple minutes to present for you the policy brief. And I have to say first, I'm really happy I had the opportunity to do that. And I'm very happy that we managed to finish this work in time. The story is that in late May, very late May, we were invited by the Lancet Countdown to write a policy brief for the first time for the Norwegian context. With short deadlines and everything, but we really couldn't miss that opportunity. So we decided to go for it. And at the same time, we were presented, as you've heard now, for several different indicators that's provided by the Lancet, which are particularly interesting to follow when tracking the impacts of climate health and destruction of nature on human health. So the list that we got at the beginning was 32 indicators, I think. It has been expanded a little bit, as you heard. And also we had strict regulations from the Lancet which indicators to choose. They had to be relevant for the Norwegian context, but also they had to sort of embrace the adaptation path on the indicators and also the mitigation. So we were discussing for a while and struggling a little bit to decide which indicators to choose. And also the whole background from the Norwegian context, and particularly my own experience, and we discussed this within the group as well, is that the topic of health consequences of destruction of nature and climate change really hasn't received a lot of attention in Norway. That's at least my personal experience. And so we discussed, why is that? What are the reasons for that fact? So is it because Norwegians sort of are not affected by the consequences of climate change and destruction of nature? That is possible. we wanted to focus on that topic as well, but we also wanted to give an example of something that's really happening in Norway that has been changing over the last years, which is a direct consequence of extreme weather events. So that's why we chose the 3 indicators which are discussed in the policy brief, which are flood and drought, which is absolutely, Norway is a weather country. So we have experiences with floods and droughts previously, but they have intensified and become more frequent. So we wanted to discuss that topic. And then also in all health emergencies like this, preparedness, detection, and response to these emergencies are of vital importance. And I think the COVID-19 pandemic has really made that relevant and shown us how important it is. So also with the recent Corona Commission report in mind from Norway, which concluded that we were not prepared for what we should have been prepared for, we wanted to discuss that as well. And then finally, we wondered if some of the reason why we are a very little climate concerned population in Norway, what is the actual reason for that, and what is media's role? What does the role media play within this very important and overarching question? So that was the final topic we wanted to choose. So from the list that we were provided by the Lancet, which shows flood and drought as the concrete example that Norway is being affected, we wanted to discuss detection, preparedness, and response to these emergencies, and we also wanted to sort of highlight and look into what are media's role in discussing this topic in Norway, and could that potentially be a reason why we look at ourselves as some somewhat climate inert population. So that was the whole background and the reason why we chose these indicators for this policy brief. The first one from the Norwegian side. So I'm happy now that these 3 focus topics will be discussed in more detail by Hege Hisdal on the flood and drought topic. Bjørn Gunnar Iversen from the Public Health Institute will discuss the detection and preparedness part of it. And then we are very lucky to have Bent Skjærstad, a journalist, also to sort of give some thoughts and ideas around the last focus topic. So I think that's all from me. Thank you very much, and I hand over to you.
Thank you, Kristian, for this brief summary and for familiarizing us with this policy brief that can now be found both through a link in the chat, but also at the website of the Lancet Countdown, as well as at the website of the Center for Global Health at the University of Oslo. As Kristian already said, we have now invited 3 experts to share their perspectives in this field. And first out is Hege Hisdal, who is the director for the hydrology department at the Norwegian Water Resources and Energy Directorate, NVE. Importantly, she is also a hydrologist holding a master's degree about flood forecasting and a PhD about droughts. Hisdal has been involved in many projects looking at climate change effects on natural disasters and climate change adaptation. And I'm looking forward to hearing her reflections. Please go ahead, Hege.
Thank you and good afternoon, everyone. And thank you for the invitation and the nice introduction. I'll try to share my screen. So can you see the screen?
Yes.
So let's see if I this in. Okay. So as I'm affiliated both with the Norwegian Water Resources and Energy Directorate and the Norwegian Center for Climate Services, you will see slides with 2 different logos in this presentation. And I should add that the Norwegian Center for Climate Services is a collaboration between NVE, the Meteorological Institute in Norway, and the Bjørn Center for Climate Research and the Norse Center for Research. And we aim at providing a basis for climate change adaptation and climate change effect studies in different sectors in Norway. We heard Bjørn Samset talking about the changing climate. and climate in Norway is changing as well. This figure illustrates this by showing the mean annual temperature in Norway from 1900 until today. And the black solid lines show the 30-year annual mean temperature, and you can see that temperature has increased by more than 1 degree. The annual precipitation has increased by almost 20%, and extreme precipitation has increased even more. When temperature and precipitation changes, we also get a change in the hydrological cycle or the water cycle. So the cycle, the speed of this cycle is increasing, and this leads to a change in the processes, and we get a change in the seasonal river flow, and in particular we get a change in the hydrological extremes, and that is floods and droughts. So I will talk a little bit about what we have observed when it comes to floods and droughts and what will happen in the future, and then finally say a little bit about potential consequences of that. So this is from a study done by some colleagues of mine on trends in different types of floods from 1972 to 2012. And you can see every dot represents one river, so we have approximately 120 rivers. To the left, you can see the change in the number of rain floods, and blue indicates a strong positive or a weak positive trend. So there are definitely more blue dots than red dots, so we see more rain floods. And to the right, you can see that red dots are dominating, and that illustrates the trends in snowmelt floods. So we have fewer snowmelt floods than we used to have. So a change in the number of rain floods increasing, number of snowmelt floods decreasing. And when we look at the magnitude of the floods, we do not see a picture that is as clear as for the causes of the floods. So still, it's the temperature effect that is dominating when we look at the trends in the floods. This is from another study looking at trends in summer droughts, and that is the number of days where you have a very low river flow. And red indicates an increasing number of days with low river flow. And for Norway and the southern part of Norway, you can see a number of red and orange dots. The picture is not as clear as for floods, but we still conclude that we see a tendency towards more severe summer droughts. And each of these maps is the trends in different periods. So to the left, you see 1920 to 2002, in the middle from 1941 to 2002, and to the right from 1961 to 2000. And it could be that if we had repeated this study, looking at river flow until today, 2021, that these trends would have been stronger. So what have we observed? To summarize, more intense precipitation, and this leads to more stormwater runoff and more overland flow. And you can see this on the picture to the right here. This is a result of very intense precipitation where we get a lot of overland flow, and the water is no longer only in the riverbed, but it flows everywhere. We also have seen that we have more rain floods, fewer snowmelt floods and earlier snowmelt floods. And we also have a tendency to more severe summer droughts, in particular in southern Norway. So let's then turn to the future. What will happen in the future? We will have more intense rain, and in particular, the extreme rain will increase more than the daily average rain, and thereby the stormwater runoff will increase, and also the flash floods. We will have a change in floods. So rain floods will become larger and be more frequent, and snowmelt floods will become smaller and less frequent. So the tendency that we have already seen will intensify in the future. How much depends, of course, on the greenhouse gas emissions. And the map you see here on the right is based on high emissions from the previous IPCC report, the 5th assessment report. And let's hope that this will not be the result. We will also have a change in droughts. The figure to the right here represents different types of droughts with different emission scenarios. On the top, you can see the change in meteorological drought. Hence, that is the change in periods with no precipitation in the summer months. And as the maps are green, it means that in this study, we see that there will be no change in meteorological summer droughts in Norway. However, as temperature will also increase, we get a large increase in evapotranspiration, and that means more severe soil moisture deficits, so an increase in soil moisture droughts. We'll also get lower groundwater levels and less river flow or runoff. So we get an increase in agriculture and hydrological droughts, even though we do not expect precipitation to change, or we even expect precipitation in the summer months to increase a bit in the future. And this leads, of course, to an increased need for irrigation. The agriculture in Norway is not based on a large need for irrigation, but that might be the case in the future. And we also expect a further increase in the wildfire risk and an increase in the situation where we have empty wells, for example. So it could be that we will have to dig deeper wells to get water supply in the future. So to summarize, what can we expect? We can expect more stormwater runoff and overland flow, an increase in the number of more severe rain floods and fewer snowmelt floods, and an increased probability of more severe summer droughts. And these results are all summarized in what I would call the IPCC report for Norway, the Climate in Norway 2100. And this report was issued some years ago based on the 5th assessment report. And we are now working on updating the report based on the 6th assessment report that was presented by Bjørn Samset. So what are the consequences? Well, here are some consequences of the 2018 drought in Norway. We had a very severe drought 3 years ago, and there were large losses in agriculture. So there were production losses of approximately 5.5 billion Norwegian kroner, of which 2 billion Norwegian kroner were covered. We had some wildfires, but as we had favorable wind conditions in Norway, they were not as severe as in Sweden, that had really challenges with wildfires in 2018. We imposed restrictions in domestic water supply, and we had a number of farms that had empty wells, so they had to transport water for their livestock, etc. And there were damages to ecosystems. So those are some of the consequences that we saw in 2018. We could say that people don't die directly in Norway because of drought. But we have actually had droughts that led to very high energy prices, where old people turned off their heating in the winter and froze to death in their apartments. So indirectly, you could say that drought actually may cause fatalities in Norway as well. And then let's have a look at the floods. We have seen fatalities because of floods in Norway. I've been working for more than 30 years here at NVE, and within those years we've had 2 fatalities because of floods, so not very many. And we also have had luck. We have not had many physical injuries because of floods, but we see that people have mental health impacts because of floods. So that's maybe the major threat because of floods to health. We see a lot of economic losses because of destruction of buildings and damages to buildings. and destruction and disruption of infrastructure. Infrastructure also includes water and sewage infrastructure. There is a lot of destruction of arable land. And we have seen a number of cases with flooding of sewage plants that leads to pollution. So those are some of the consequences. And that was it. Thank you for your attention.
Thank you, Hege. Thanks for sharing your insights and future expectations from a national perspective, and also for staying with us until the panel debate at the end. And I have to say also thanks to you and to all the panelists for being so very excellent in your timekeeping. We really want to make sure that we have time for some discussions at the end. And therefore, before we move on, I want to take the opportunity to remind you to engage with our excellent speakers during the Q&A session by posting questions, which again can be done by using the Q&A button located at the bottom of your Zoom screen. Now I have the pleasure to introducing another colleague from the Norwegian Institute of Public Health, Dr. Bjørn Iversen. Bjørn is the Senior Medical Officer at the Department of Infection Prevention and Preparedness and has a long-standing career in global health, both within the Institute and beyond. He has been involved in emergency preparedness nationally and internationally, and has on multiple occasions been in charge of outbreak management and control. One of Bjørn's main focuses has been health security, including the international health regulations, which he will tell us more about. So please go ahead, Bjørn.
Thank you very much, Karine. And it's been very interesting for me to listen to the previous speakers also. And I will shift the focus a little bit onto more on communicable diseases and epidemics, and try to tie this or connect this to climate change and mitigation of consequences of climate change. Let me see. Here, the international health regulations are very much focusing on scourges and epidemics. And here's a picture from England during one of the cholera outbreaks, how devastating and frightening those epidemics were. And here is death harvesting from the population. And in this interconnected world, a new strain of a pandemic or an epidemic causing agent is just one flight away. So a threat anywhere is a health threat everywhere. In order to understand the international health regulations, I would like to take some steps really back and focusing on the history of Europe when the bubonic plague came in 1347, and what kind of measures that were implemented in order to stop the spread of disease. In 1377, the first quarantines were introduced in some of the stations of the Venetian Republic. This is from Dubrovnik in today's Croatia, that quarantine was introduced in order to stop the introduction of a new epidemic disease. And quarantine, alluding to that the ships needed to stay for 40 days before they were allowed to dock and then to unload their cargo. Also, they introduced later on lazaretti, which is hospitals where they isolated the sick so they shouldn't spread the disease, and the purgation of the cleaning of goods so they shouldn't spread the fleas with the infections. And this developed across Europe over the centuries, but mainly it was not how the countries or the states should be best prepared, it was how to stop the spread between countries and states. In the 1830s, cholera was introduced from the Bay of Bengal because the British learned how to sail the ships very quickly from Asia to Europe, and we saw severe cholera outbreaks in many of the European cities. Then international communities started to discuss more and to interact, and the French invited to international sanitary conferences, first in 1851, and had 10 conferences up to 1900. They introduced what they called cordon sanitaire, which is a ribbon or isolating areas where epidemics were occurring, preventing people from coming in. And then the first International Sanitary Convention was approved on in 1892. But it wasn't until the establishment of the World Health Organization and in 1951 that we had the first international sanitary regulations intending to prevent the spread of cholera, plague, smallpox, typhoid fever, and yellow fever. And that was changed then in 1969 into the international health regulations. And the current regulations we have today was agreed upon in 2005, and it was the first international legally binding regulations on health. It was agreed by all WHO members, and it defines the rights and obligations of countries for cross-border public health events and emergencies. And as you can see, still, it's not about how countries can be best prepared, but still leaning into how to prevent the spread between countries. They also define some of the core capacities, I'll come back to that, but not very much in detail. But one of the new things that was introduced, that instead of identifying the known disease, they also opened up to new undefined diseases to be included. And that's why they introduced this term called Public Health Emergency of International Concern, or a FAKE. And we should be really happy for that today, when both with SARS and with Ebola and with now the COVID-19, they hadn't been defined earlier on and wasn't then included in the earlier versions of the IHR. And the purpose of the IHR, as stated in its Article 2, is to prevent, protect against, and control and provide public health response. But again, against the international spread of disease. But again, it focuses quite a bit that it should only be in the least necessary measures in order to, so that we didn't introduce or interfere with international traffic and trade. That was still very important. How do we monitor then, shifting then from the spread of disease between countries, how a country can be the best prepared? And what kind of assessments or evaluation frameworks are needed? And WHO developed something called the SPAR, which is a mandatory state parties annual reporting. We know self-reporting, you tend to over-exaggerate how good your own country is. So it's quite biased. Then with the initiative from the Obama administration, development and establishment of the Global Health Security Agenda, they developed something called a joint external evaluation, where international experts together with national experts should come together to assess how well a country was prepared for handling a pandemic. Two other evaluation frameworks are listed with WHO: simulation exercises and after action reviews, and now for COVID also interaction reviews. All of this should lead into national action plans for health security, and they should be implemented. What we have seen is that it often stops with the assessments or possibly the plan, but very little implementation, especially in resource-poor countries. And also other frameworks have been developed. Global Health Security Index by Harvard University together with The Economist. And what we have seen now during COVID-19 is that many of these assessments have missed the target. The Global Health Security Index put United States and United Kingdom as the best prepared countries against pandemics. And we have seen this was not the case. And I come back to why. But just to say now that it's one of the issues is that these focus on very narrowly on health security issues and not the broad perspective. The IHR itself doesn't specify the core capacities the countries should have, but that is specified more in the SPAR and the JEE. And now, hopefully soon post-COVID, we're in the process discussing with WHO how to revise these. And one of the issues we have presented is that at least you need to align the SPAR and the JEE so it's organized in the same way. Because they have different origins, they are not organized in the same way. But for the JEE, they categorize them into to prevent, detect, and respond to health emergencies. And it's almost all about infectious diseases, but you see at the bottom, they also cover a little bit on chemical events and radiation emergencies, but not on climate change. Then currently there are ongoing very many assessments for COVID-19, and the Global Preparedness Monitoring Board, the International Panel for Preparedness and Response, the IHR Review Committee, and the Independent Oversight Committee. They look at top political leadership. They state we need to have more treaties, WHO should be strengthened, countries need to implement the IHR, we need to have more equitable access to vaccines and medications, funding is important, and also we need to look much wider than we do today, and several of them mentioned the One Health perspective. How can this relate to climate change? First of all, climate change lead to health security issues. But also for natural disasters, there is this Sendai framework looking into how to prevent, prepare, and mitigate natural disasters, and looking at technical capacities of disaster management, whereas the IHR are looking more into the technical capacities of health security to prevent, detect, and to respond. But more and more, we need to focus on governance, engaged communities, and resources, core capacities that are common both for climate change emergencies and communicable disease emergencies and pandemics. I'll skip the Sendai framework. Perhaps you know that better than I do, but these are some of the targets. They state what should be increased and reduced to prevent and mitigate natural disasters. Also, WHO, together with others, are trying to look into how to broaden the scope so that you're not just looking at narrow health security issues, but health systems in general. And together with Leeds University, they have developed this HS for HS, or Health Systems for Health Security, that focusing on the whole of the health system and saying that it's important to link the two issues. We need to have consensus of what capacities are required. We need to have a comprehensive national and subnational approach, because we know for emergency preparedness and response, and especially in low-income countries, there are vertical silos that are not collaborating. There's a shortage of experts, and as you see at the fifth recommendation here, they say that we need a whole of society approach. Another recommendation that was issued earlier this week on Tuesday was the WHO position on universal health coverage and health security, with some policy recommendations. And across many of these assessments and recommendations, they emphasize the strengthening of primary healthcare as a cornerstone, both for health security and universal health coverage. And of course, of research, and also to look at all hazards emergency response, which also then takes into account the consequences of climate change. And we have seen the inequalities and inequities, not the least also in Norway, where the COVID-19 pandemic has hit certain subgroups of the population much harder than others. I'd like to sum up everything in this figure that we have made a report that we sent to Nordstrand from the Global Health Preparedness Program, saying that, and this is explaining a bit why the international health regulations and the IHR monitoring and evaluation framework is not sufficient to describe the resilience of a society. Because we have the international considerations around, we have national variables, and we have seen in research that corruption is more important than the gross national product of a country. Inequalities, trust in government, all these issues also needs to be addressed if you would like to have a resilient and health security system. And I think we can work together with the communicable disease and the pandemic preparedness people and the climate change people to address these issues, because they are quite common on many related issues regarding preparedness and response for society. Thank you.
Thank you, Bjørn, for sharing your experience, for providing us also with a historic background, helping us connecting the past and the present, and also, like Dr. Semenza previously, demonstrating really the complexity and interconnectedness of these issues. Now our last speaker out before we move to the panel debate is Skjærstad. Bent is an experienced journalist and communication professional working for TV2, Norwegian broadcast, as an international reporter. Bjørn has previously documented the impact of climate change on Greenland's native population and their livelihoods, and is, as I know, planning a trip to the Sahel region to explore the impact of climate change on migration and nutrition, among other things. Ben frequently uses research material and researchers as sources for information in his journalism, and is going to share his perspectives on how to reach a broader audience. So go ahead, Bent.
First of all, thank you for being invited to this discussion. As we see, the policy brief shows little coverage of climate change and health risk. If we would look into the numbers of coverage of climate change, they would probably be much, much bigger. But at the same time, the reason would be that the media coverage is quite big every time Code Red is being declared. And we would maybe find out that the coverage of how climate change affects us in Norway and how it affects people directly is not as big as the numbers maybe could indicate. I think this is one of the problems who's been through many years now. It's been big coverage of meetings like the COP who's coming up, and it's been big coverage when UN reports are being presented, but we haven't gone into the depth of how climate change is affecting us. And when I was presented or asked to be on this discussion, and where we talk about climate change and the health risks being caused by climate change, this is something who's in a way something new for me. We've been talking about climate change and migration and all sorts of things a lot, but the health risks has not been a big discussion when we talk about climate change. I know the awareness amongst journalists in Norway is bigger now. It's a lot of media outlets who are letting the journalists go more into depth and putting up their own desks who are covering climate change and all sorts of angles within that area. But I would say through the years I've been working with climate change and other scientific projects, I would say communication has been really important. I could be presented or reports could be presented to me all the time, but at the same time, when a report is finished, it's a lot of material to go through. So for me, it's been important to have a communication with the scientists through their work and through the period before the presentation of the reports. And that's the question I would ask myself. Are we having a good enough communication with the media outlets? Could we change the way we communicate with the media outlets? I think one of the ways who are good to get the message out is having a good communication with journalists and maybe find your own journalist to put it like that, to talk to them and make them understand the research work you are planning to publish and the research work you are going into depth into better, so they understand this research much better when it's being presented. And that's something who would maybe change it from one story when things are being published to many stories who the journalists see through getting into this research project. This is something I've seen myself when I was working on sea levels rising. We had a close communication with, for example, researchers on the Bjørn Center in Norway, and through these discussions, we found angles who showed and where we could go out and show more directly how their research would show how people are being affected. And this is something who makes our viewers and readers take this in a different way than when they are being presented just numbers. And this is also something who makes it easier for me to come to my editors and get this message out and get my stories out and get my stories in top of the news. And this is something I've been discussing with colleagues. I have Abraham Lustgarten, who were one of the first journalists in the world who really made this climate change frontline material in New York Times. And we've discussed this, how important it is to have a long process to get to understand more as a journalist, to make the viewers and the readers understand more as well. So I think one of the ways to get this message out is to sit down and think how this communication amongst the media and the scientists could be better and to change it. And instead of presenting reports at press conferences, I think this communication needs to be ongoing through your research. And I think I'm going to stop there so we can discuss this a little bit more during the panel discussion.
Indeed. Thanks a lot, Bent. Very, very much appreciate your contribution from a slightly different but still critical perspective. And I'm sure that your reflections provided quite some food for thought for many others as well. Now, time moves fast, I see, and we now have about 30 minutes left for a panel discussion. Now, you still have the possibility to post questions to the panel by using the Q&A button located at the bottom of your Zoom screens. So I will ask all the panelists to turn on their screen, their cameras. And my first question goes out mostly to you, Jan, but also the others may chip in afterwards. So in 2016, the Lancet Countdown tracking progress on health and climate change was formed to establish a global monitoring system with ability to engage policymakers and support health professionals. There have been annual reports released since, highlighting the progress made, as well as key challenges. And now looking back at the past years and this year's report with the headline Code Red for Health, how's your sense of hope doing?
Great question, and I am totally with you. Basically, we have been documenting these impacts over the years, and it just gets worse and worse. And I think that the thing we need to realize is that mitigation will not have an impact on the climate sufficiently big to reduce those impacts on health in the future. So the only option that we have right now is adaptation. So I believe, as the previous speakers have highlighted, that we need to have an engaged community at the core of everything we do. So I've worked a lot on early warning systems for heat-related mortality or infectious diseases. And if the community is not engaged, those early warning systems don't work. So the key thing for public health, I call it lateral public health. We need to have a dendritic approach to public health where we can connect communities with decision makers, with other stakeholders, with public health officials, and engage everybody in the discussion how to minimize those potential impacts, because the impacts will come. Mitigation is too late. It won't reduce those risks. So it is about adaptation. How can we protect the health of the public by engaging community? That's where it's at.
Yeah. Thank you, Jan. I don't know if anyone else from the panel has something to share that makes them hopeful, or any positive trends that they would like to highlight. Nothing. Yeah, Bjørn, please do go ahead.
I would very much like to comment on Jan's input on engaging communities, and this is extremely important and absolutely necessary. And we've seen from COVID response in countries, at least in democracies where the government have told them what they would like to tell them, not the truth always, then you don't have the good response from the general population. And Norway has been one of the exceptions where we've been very open with what we know and what we don't know, and trying to engage communities as much as possible in the response to COVID, because we can decide on measures what is allowed and not allowed. If the population don't feel that this is the right thing to do, they don't do it. Then they built their houses on sand ground, close to the rivers and by the water and whatnot, if they don't believe in the message from the government. So to have the closeness and the trust from government is just as important for climate change as it is for infectious diseases or other measures. Thank you.
Yeah, thank you, Bjørn. And I think even if, you know, the code or the headline of this year's report is Code Red for Human Health, and I think it's still worth to keep in mind that I think one of the previous reports for the Lancet Countdown was more focusing on considering this as an opportunity to kind of strengthen health systems and to, you know, enhance human health and encourage people to have more sustainable diets, to, you know, exercise more. So seeing this also as an opportunity, I mean, adapting to climate change to also a positive opportunity for human health. So I think that is something still worth having in the back of our minds, even if the headline this year is Code Red. Now, coming back to the last presentation from Bent, I'm a bit curious to hear also from the other participants. I mean, Bent, you said a little bit about you had some reflections and suggestions on the importance to have, to work strategically with relationships, building relationships with the journalists and the media from researchers' side. And I just would like to hear from the other panelists how you see Bent's reflections and suggestions. Does any of you have any close relationships with journalists and work strategically on building such relationships? And how do you consider that, Hege? Please go ahead.
At the Norwegian Center for Climate Services, I don't think we plan strategically towards the media, but we are quite pleased with how the media has covered climate change, and in particular there has been collaboration between NRK and the Norwegian Center for Climate Services, and they provided information about the report Climate in Norway 2100, both with respect to how climate has already changed and with respect to how climate might change in your municipality. And actually, that media cover on how climate might change in your municipality won an international prize for the best media coverage on. So we are quite satisfied with how media has increased their awareness on climate change. However, there is very little in Norway about climate change and health. And it could be that we consider that the Norwegian health system is very resilient, that we have a very good public health care system. What has not been considered a lot by the media is sort of the mental health issues that might arise from natural disasters and the increase in natural disasters and the fear of natural disasters. And I'd like to mention one example, and we have it's not directly related to climate because it was a quick clay slide that happened in Gjerdrum in January this year that caused a number of fatalities. But the municipality was rather pleased with all the help they got from different bodies, governmental bodies, etc., but they had one major lack of help, and that was related to mental health issues, that where they actually needed more support and they couldn't receive it. So I think that's an important example where media could have more attention.
Yeah, thank you, Hege. Over to you, Bjørn.
Yeah, thank you. Would just like to add on to that a little bit. I mean, as a relatively active climate communicator, I speak a lot with the media, and I can echo Hege's first thoughts that I think the media in Norway are very good and very competent really at communicating the broad levels of climate change. And I also agree that there hasn't been much coverage of the climate and health interaction, where I support the recommendation in this Norwegian policy brief that should be something we can try and work with media to get more coverage of. But I also see a potential issue there, because one thing we are seeing a lot now is the growth of climate anxiety among the young people. And that is really becoming a scary issue for a whole group of people. And there is nothing more scary than being told that there's an imminent threat to your own health. So when we add that on top, I am slightly worried about what the impacts will be. That's not to say we shouldn't do it. If you want to do adaptation, you have to be forewarned and know what to adapt to or against. So it certainly needs to come out there, but I think it needs to be done with a very careful hand. And then that is something I hope we can communicate with the media on, because further disaster headlines on this will be detrimental to a whole generation, I'm afraid.
Yes, thank you, Bjørn. And Kristian, I think you want to feed in on this.
I just want to comment very briefly as well. First, I want to respond to Bent Skjærstad's mentioning the importance of communication between scientists and researchers and the media, and I think that's extremely important. We have I experienced that clearly during the COVID-19 pandemic, the importance and also difficulties in communicating really clear and to bring out the message as clear as possible. So I absolutely agree with you, and I think that's something we really should try to improve further on. I just want to underline a little bit that, you know, the coverage of climate change that we sort of comment in the brief is strictly related to climate change as a threat to human health. So it's the connection, health and climate change. And I just have to mention also that I was at this very big international conference a few years back. There were people from all over the world attending the conference, and I was actually the only person from Norway attending. And this was one of the biggest international conferences on what's called Planetary Health, which underlines that climate change and destruction of nature is a threat to human health. And it's this link, to couple these things, that I have been missing, at least personally, in the media, both in social debates and in social platforms and in media in general. Thank you.
Yeah, and Kristian, I think just to add to that, not only in media, but also in the general discourse in the Norwegian Medical Society, I think that has been lacking over the past few years. It's getting better, but still have clearly a way to go there. So looking at the questions in the chat, there are several mentioning the link between climate change and infectious disease, non-communicable disease, and exacerbating antimicrobial resistance. So one of them is, and I guess this goes a bit to all of you, but how has any work been done on the link between climate change, natural disasters like flooding, and antimicrobial resistance and impact on public health? I guess that is mostly focusing on the Norwegian context, but also possibly to answer from a more global perspective. And a bit of a follow-up to that, I'm also curious to hear from you what kind of is the status on research when it comes to this topic of climate change, natural disasters, and health in Norway. Does it enable us to make informed decisions and planning and adaptation, as you focused on, Jan, being kind of ahead of the curve, so to speak? So anyone who would like to answer these questions?
I can take a quick stab at it, Karine, real quick. So we have done a systematic literature review on natural disasters in Europe and how many of those were associated with infectious disease outbreaks. And we did see, in fact, some of these natural disasters that were associated with these type of outbreaks. 4 of them were associated with leptospirosis outbreak, which is transmitted through rat feces and things like that. And if you mobilize that by a flood, a lot of people can get infected. So there is an association, but it's not a big disease burden overall, based on our assessment. Another question there also pertained to to air conditioning and infectious diseases. And Legionella is associated with air conditioning use because it creates a biofilm on the air conditioning unit and then disperses in there, and it can cause very severe lung infections that can potentially be fatal. Another good thing about air conditioning, though, is that they can prevent dengue exposure, because in the US, in Texas versus Mexico, in Texas, there's very little dengue compared to in Mexico because they use air conditioning and protect the environment from exposure to mosquitoes. So there are different aspects to air conditioning that are complex from a public health perspective.
Thank you, Jan. I see that Hege has her hand up too.
Yeah, just a small comment. To my knowledge, there is not a lot of research on climate change, natural disasters, and health in Norway. I don't know about internationally, but at least in Norway, there's not a lot of research on that. I know about one project on extreme precipitation, floods, and waterborne diseases, and that's the only project where I have been involved on that topic. So I think there is a room for more research on climate change and health effects in Norway. But as I said, I don't know about how the situation is internationally.
Yeah. Kristian, would you like to expand on that?
Just have a short comment on the AMR, climate change, disruption of nature question, because AMR and the spread and development of AMR has been linked to climate change and destruction of ecosystems. The connection is not very clear, and it's difficult to sort of document it quantitatively, at least. But you can say that climate change and increasing temperatures and these things definitely are associated to spread and increased burden of infectious diseases. And if you have more infections, you need to use more antibiotics. So we have this indirect link that is pretty clear. So of course, one of the biggest, what's most important that we can do to combat AMR is to reduce the amount of bacterial infections. So it's absolutely coupled, but it's difficult to sort of show the direct link between climate change, increasing temperatures, and AMR. But it's there somehow.
Yeah. Thank you, Kristian. Another question in the chat is not on infectious diseases, but on non-communicable diseases. And I'm not sure, as both Bjørn Iversen and Kristian Rødland, you are kind of infectious disease specialists. I'm not sure we have a non-communicable disease specialist in the panel, but maybe Jan, you can answer this one, or anyone else. What impact do you think climate change can or will have on non-communicable diseases? I'm not sure if you have any indicator in the Lancet report.
You know, I started working at the US CDC in '95. Before I had my training, I was shipped out to lead the heat wave investigation in Chicago. It was the biggest heat wave ever that killed more than 700 people in the United States. And Norway is also at risk for heat waves, because the further north you go, the less are people adapted to heat. And if the heat hits early in the summer season, people are not adjusted to that. They can't cope, and then people die. There are lots of studies that have come out of Sweden, for example, that looked at the impact of heat waves on heat-related mortality and morbidity, which is definitely something that is an issue in Norway as well. Just because we are north doesn't mean that we are not at risk for heat-related mortality.
Exactly. Kristian, coming back to the policy brief, and I'm sure, or I would expect that maybe some others also had this thought when they heard your presentation and the choice of indicators. So why did you select an indicator which addressed Norway's dependency on oil and gas production, which is part of the scope of the Lancet Countdown report globally?
That is a very good question, and it's also somewhat a little bit sensitive question. I can tell you that we really discussed this thoroughly in the group, and some of us believe that we should address it and should bring that to the table. Norway's dependency on oil and gas and how important that is for Norwegian economy. It's been discussed quite a bit. It's like I said, it's a sensitive question because I think it's being discussed slightly in sort of a polarized way, that you have people against and for it. We decided to actually, and also this is the big elephant in the room in Norway, because we like it's written in the policy brief, we look at ourselves as the front runner in the world when it comes to climate and preservation of nature, etc. Maybe that's how we imagine ourselves is not correct. So what we decided to do was to wait, actually. We don't forget it, and we keep on discussing it within the group, but we will wait, and we would like to address 3 topics that was not that politically sensitive in Norway, but also which there are possibilities actually to do something and to make an impact and to make a slow start, in a sense, in our efforts to contribute to this topic. And then we can't forget the dependency on oil and gas, but I think we can spend some more time to discuss how to address it in a sensible way in Norway, because it's a little bit too edgy at the moment, in my opinion.
Indeed, but let's see what the future brings. So Bjørn Iversen, I was curious to hear from you whether, I mean, you talked a lot about health security and international health regulations, but to what extent do you think climate change and health may be included in the international health regulations when they will be revised? And if that's not a possibility, how do we best kind of collaborate to work together and prepare and respond to epidemic emergencies and emergencies caused by climate change? It's a big question.
Thank you. I think perhaps it's not the best suited way of addressing it, because the IHR, as I said, was very much focusing on communicable diseases, and they tried to include the chemical emergencies and radionuclear emergencies because they are also cross-border events, the outbreaks, or we know from Chernobyl how it spread, and sometimes for chemicals as well, but usually also chemical emergencies are within one country, and the IHR is very much focusing on transnational. Of course, climate change is a global issue, but the emergencies occurring are not so much. And then I think that it's a better approach to look at how we can adapt to the new situation and how we can set up preparedness systems and response to emergencies where we can collaborate much more. And as our experience now with the COVID pandemic is that not only going from health security to health systems approach to a One Health or all of government approach, but it's an all of society approach that we need to take. And this is very much the same, I think, as it is for mitigating the effects of climate change. And there we would need to collaborate much more. And for the Norwegian context, communicable diseases as a result of climate change is probably not the most dangerous of the issues affecting us. We might have a few more diseases, we might see some cholera-like illnesses and even spread of malaria and insect-related diseases, but perhaps that's not what's scaring the people and what will affect most people. So we need to look into other issues, and we need to collaborate more on mitigation measures.
Indeed. Thank you, Bjørn. We only have a few minutes left, but before we end, I'm curious to hear a bit from you again, Jan. I mean, when we met before this webinar briefly, I heard that you were talking Norwegian actually, so you are quite familiar with the Norwegian context. But to what extent were the findings and the recommendations in the Norwegian policy brief recognizable from your perspective? Were there any surprises? I'm not sure if you had the time to really have a look at it yet, but if you did.
Yeah, thanks, Karine. I love the policy piece. It's a very well written piece, and I love the take-home message. And in fact, I just published a paper just in parallel in the Lancet Europe on a very similar topic with exactly the same context, putting the community at the center of public health by creating social capital within the communities to have the capacity to advance preparedness and response activities. And I list a lot of examples of how communities can be prepared for climate change impacts if they are able to get their act together to be prepared. We did look at Norway specifically when I worked at European CDC last year, where we look at precipitation patterns that are predicted to increase in the future. And we saw an increased risk for waterborne disease outbreaks in relationship to these precipitation events. So we do know that if the climate will change in the north, as it's predicted to do, we will see more rain, we will see more waterborne outbreaks, and we need to prepare our systems to cope with those type of impacts. And the community is essential to that.
Yes, thank you, Jan. before we round up, I just want to mention that we have a comment also in the Q&A that there should have been a politician in this panel, and we very much agree upon that. We tried, but it's kind of difficult to get hold of politicians these days as they are changing the cabinet and so forth. But that's for next time. But I'm very happy that we at least managed to have a journalist with us, Bent. I mean, this is the second webinar on kind of health and science that we are in over the past 3 weeks, Ben. So very happy to have you with us, and I hope that it was provided some new perspectives to you as well. And I just want to say then, rounding up, saying thanks a lot to all the panelists, and then leaving the word to Jeanette to make the closing remarks. Thank you very much.
Thank you very much, and thank you for an exciting hour and a half, and thank you to all the speakers, and especially to you, Karine, for being our moderator, and also thank you to the audience that has been following us today, and a special thanks to the Center for Global Health staff making this a successful event. And if you missed some of the discussion, visit our website for the recording, and please stay tuned for our other events, and welcome back another time, all of you. Have a great weekend.